Good afternoon, everyone, and welcome to Progress Reporting Office Hours. My name is Ginger Barron, and I'm a senior analyst at the Justice Department's Office on Violence Against Women, where I manage OVW's performance measurement portfolio and our research and evaluation initiative. I'm joined by my colleague, Emma West-Rasmus, who is working with me to ensure that we get you answers to your questions, whether it's on this call today or in a follow-up email. Next slide, please. Before we start, I'd like to invite team members from the Measuring Effectiveness Initiative to introduce themselves. I think that'll be Tara today.
Yes. Hi, this is Tara Wheeler, and I work at the VAWA MEI, the Violence Against Women Act Measuring Effectiveness Initiative. And my responsibilities include working closely with OVW and grantees on reporting and collecting data. I'm also accompanied by my colleague, Julia Bergeron-Smith, who's been working directly with trying to compile all the questions that have come in and works on TA, technical assistance and training matters. Thank you, Ginger.
Thanks so much, Tara, and thanks, Julia, as well. OVW's longstanding partnership with MEI has helped document the life-saving work that OVW grantees do to address domestic and sexual violence in your communities. Last and certainly not least, a hearty thanks goes to all of you participating today. Even in the best circumstances, you regularly encounter people during their toughest times, and you routinely work to make your communities places where safety and justice are within reach. Now, with the upheaval brought about by the COVID-19 pandemic, your work may be much more challenging than usual, and you might be finding yourself struggling to maintain the public safety and victim services strategies that you've put into place with your grant funds. That you've taken time out of your busy day to be on this call is a testament to your commitment to maintaining integrity and success in your OVW-funded work, even when times are tough. So we went through the questions that you all submitted and grouped them into some general categories. Rather than addressing every question individually, I'm going to explain the gist of the questions and provide you with an answer. Then we'll open things up for whatever other questions are on your mind today. Please note that I won't be answering questions in the chat box as they come in, but you're welcome to type your questions whenever, and Tara is going to keep track of them and will queue them up for me to get through after this first part of the webinar. Before we start, I want to let you know a few things up front. First, as a general rule, before, during, and after this pandemic, OVW strives to support our grantees in being successful. We understand many of you are facing uncertainty and new challenges right now. There are many topics for which we have not and probably will not issue across-the-board guidance, but we are here to support you, work with you on modifying your projects, and link you up with resources in TA that might be helpful. You'll hear me say several times that communication is key, so let us at OVW know what's going on and what you need. Second, please be sure to check the resources and FAQs for grantees section that you'll find on OVW's website. Whenever we are able to issue written guidance to help grantees navigate challenges the pandemic presents, we post that guidance there. Third, we received a lot of questions for which the answer is very program or grant dependent. The most frequent response I have to the questions submitted is, it depends, and best to check with your OVW program specialist. I'll get more into the reasons for that, but wanted to give you fair warning and emphasize that Emma, I, and the MEI team are happy to help you, and we encourage you to contact us after this webinar if you need help getting in touch with your program specialist. Fourth, we received many questions about the status of 2020 grant applications. The vast majority of those applications remain under review within OVW, and applicants can expect to be notified of funding decisions before October 1st. In the meantime, your best bet is to contact the person listed in the solicitation under which you applied. Finally, just as many of the challenges presented by the pandemic are new to you all, they're new to us at OVW as well. I fully expect you'll have questions for me today for which I simply don't know the answers. However, by asking those questions, it gives us a sense of what's presenting difficulty for our grantees and what we might be able to do to support you better. And if I can't answer your question, I assure you I'll take it back to my colleagues and put you in touch with whomever is best equipped to help you out. So without further ado, let's dive into your questions. Some of you asked for general tips on reporting right now about deadlines and what to do if you or your project partners are missing data or you just can't physically access it at the moment. So per the March 26th memo from our acting director, the March 30th deadline for STOP and SASC progress reporting, those are the two largest formula programs, and this includes the subgrantee reports, was extended to May 29th, that's tomorrow. And the deadline for quarterly financial reports for all grantees that were normally due on April 30th are now due by June 30th. Other deadlines have not been extended, but if that changes, we will notify grantees. OVW understands that grantees may be hindered in reporting complete and accurate information, especially if they or the project partners don't have access to files. Therefore, we recommend the following. Recipients should complete progress reports to the best of their ability and submit it before the deadline. Every progress report form includes a narrative field or multiple narrative fields where grantees can provide additional information about the data. Use that space to explain any incomplete or missing data. Grantees are also encouraged to use the narrative field that asks for additional information about effectiveness to describe COVID-19 related adjustments that aren't captured elsewhere in the form. Grantees who can't provide accurate counts for those numerical fields because they or their project partners don't have access to files are encouraged to just leave those fields blank rather than providing estimates. Note too that OVW will maintain its standard grant monitoring practices, focusing on grantees' progress toward project-specific goals while recognizing that victim services providers, justice agencies, and all the other types of grantees we work with must be flexible and adaptable, even under ideal circumstances. We recognize that a pandemic presents tremendous challenges, and we anticipate those challenges will be reflected in your progress reports. We encourage grantees to communicate their setbacks and successes to OVW through progress reports and correspondence with their program specialist. We also had a question about data having been lost due to a system crash, and staff are stretched so thin right now with trying to keep services up and running safely that trying to retrieve or recreate that data before the deadline just isn't feasible. If this is your situation, leave those fields blank for the data that you lost. Keep your program specialist informed about efforts to retrieve or restore the lost data. We can change request the report back to you if you enter data, like if and when you're able to get it back. But if in the end those data just aren't retrievable, explain as much in your progress report. And you'll want to discuss with your program specialist what source documentation you do have and that can support your drawdowns during that reporting period. But all that aside, continue to prioritize serving your clients in crisis, and OVW can just work with you on the rest of it. Next, we had some questions about how to report on activities and deliverables that are delayed or may need to be revised as a result of COVID-19. Also about the need to train staff and partners on providing services remotely. People ask how to account for this in progress reports and how to determine if the changes they intend to make are allowable and if they require OVW approval. There were also questions about how these delays might reflect on a grantee. What these inquiries describe sounds like what a lot of grantees are navigating right now. You want to continue to reach your target population, but without jeopardizing people's health. I suggest you do a few things. First, reread your grant award and the terms and conditions therein. That way you're clear on the scope of your project, meaning the types of activities you can do with the funds. Second, take a look at those COVID-19 resources that I mentioned on OVW's website. In the March 26th memo posted there, you'll see that our acting director outlined some administrative flexibilities that are in effect for the time being. And bear in mind that we continue to offer grantees the latitude that we normally afford you to revise your project plans, extend projects, change up deliverables, and so forth. The extent of that latitude, though, hinges on the program you're funded under, the terms of your specific grant, and your own policies and procedures, as well as like your approved budget, your project performance up till now, and other factors. So whether or not to adjust your deliverables and whether or not it requires, again, are questions best directed to your program specialist. So we understand that adaptability and flexibility are necessary for the work you do, even under the best circumstances and especially now. However, we still have to do our due diligence in considering your requests against federal regulations, OVW policies, and what's a good use of grant funds. So let me give you a concrete example of what I'm talking about here and why we can't just issue a completely across the board yes or no on a lot of questions. A grantee might ask if they can use funds to purchase personal protective equipment, or PPE, for sexual assault nurse examiners, and if that would require a GAN. There's no across-the-board answer here because a grantee whose award doesn't support SANE programs already probably shouldn't be using funds for PPE. However, a grantee already using funds for SANE programming can most likely use funds for PPE, but whether or not it requires a GAN depends on the estimated costs and the approved budget. So that gives you kind of an idea why, working with you to be flexible, we still have to look specifically at your award to make sure that we give you good guidance for getting formal approval if necessary on those requests. Please know that we at OVW remain focused on supporting grantees and meeting your community's needs during these challenging times. And just as we did prior to the pandemic, we can work with you to adjust a lot of the different features of your grant and walk through your options. The same thing goes for those of you who anticipate having large balances of unspent travel funds that you might want to hang on to or you might want to reprogram. Nobody knows what the coming weeks and months will bring, so we understand that you can't necessarily plot out the rest of your project at this time. But as you make changes to your plans, it's important to consult OVW to make sure that what you're doing is permissible under your grant and so that you can secure that formal approval through a GAN if it's necessary. And please remember that grantees are encouraged to use those narrative fields as much as possible to explain anything about progress or changes or delays in your work, and also any limitations to the data that you report. Moving on, we got some questions about how to report activities now that they're being shifted to online and remote platforms, and also when you haven't been collecting detailed data on victims served like you might have during the time that you were providing face-to-face services. And to tell you that the short answer to all of this is just do the best you can and make ample use of those narrative fields. As I said before, do not report estimates for numbers of victims served or demographics or really anything else that's a number. Any numbers you report to us should be those for which you do have adequate source documentation. Use those narrative fields to explain if you have missing or unavailable data and explain the activities that you're not able to quantify right now. The main point of your report is to give OVW information that we need to monitor your grant. So just keep that in mind and reach out to your program specialist as needed. If what you put in your report is insufficient, then we can always change the request the report back to you and ask for some edits or more details. For those grantees who report information on like protection orders requested and granted, but you don't have access to that information right now because maybe courts are closed, stuff like that, just leave those fields blank and again use that narrative field to explain why you don't have that information. Also, to the extent that it makes logical sense, continue to report services provided remotely just as you would have when they were conducted face-to-face. For example, a grantee asked about documenting supervised visits that were previously at their center but are now done on Zoom. In this case, you would report virtual visits in the supervised visitation section, just as you would normal visits at your center. But then just use the narrative box again, either in that supervised visitation section or at the end of the form to note changes to your services. Also, many of the questions in your forms have an other please specify option, which you can use to record services that don't fit neatly into any of those other categories. I would encourage you to check out materials from our Crafting Narrative webinar series. That can all be found on MEI's website. It offers examples for how grantees can use narrative to illustrate the impact of their OVW-funded work beyond what those numbers can convey. And please just remember the important thing here is that you use your progress report to explain and account for your work during that 6-month period. Some grantees asked how to document policy changes that they've implemented as a result of the pandemic. Best to use the policy section of your form and just describe the policy change in the narrative box there. This is a good way to document things like permitting longer shelter stays, obtaining victim consent to release information through remote means, etc. We had some questions about tracking training numbers for trainings that were switched to online platforms. You can report webinar registration and participation numbers as people trained. You can collect information on registrants' professional fields like law enforcement, advocate, and so forth in your online registration form too. Be certain to retain whatever documentation you use to track those numbers, just as you would for an in-person training. However, do keep in mind that if you can't or don't track something, you probably can't report it numerically. In that case, you should just provide a sufficient narrative description of the work you're doing and any evidence that you might have of its reach. Related to that, there were some questions that came in about reporting trainings that were supposed to be convened in person, but were either canceled or moved online. For trainings in TA that were planned and later canceled due to COVID-19, describe in the narrative section, and ideally you would use this section in your progress report about goals and objectives where you kind of track that progress. That would be a good section to put that information in. For convenings that were shifted from in-person formats to online forums, continue to report them as you would an in-person event, and note in whichever narrative field seems most appropriate that you change the format of the event. Moving on, some questions pertain to counting and documenting recipients of community education now that that's being provided through social media or passive education online. And so because you cannot verify how many people participated in training, it's best not to report website hits or views in any of the numerical fields in your progress report. Rather, you can mention those numbers in the narrative section if you think that they help illustrate the reach of your online resources. But please do keep in mind community education and training numbers can be audited, and auditors may ask to see source documentation to support the numbers you report. And that's really why I urge caution here. Again, the important thing to convey in your report is the work you're doing and how it's changed. And we expect that there's things that you're doing and accomplishments, that you're having and seeing in your work, as well as the setbacks that you can't quantify them as you might normally be able to do, and that's fine. There were some questions related to using grant funds for administrative and sick leave during the pandemic. So if you have those types of questions, please refer to the March 26th memo issued by the OVW Acting Director. It has a section in it on salaries and leave that you'll probably find helpful. And I can tell you, just even if you haven't looked at that memo yet, the guidance in it refers grantees to their own policies and procedures. How you treat leave is in accordance with your own policies and procedures and not your approved budget. If you were not clear on charging salaries and leave to the grant after reading through the memo, definitely reach out to your program specialist and the OVW Grants Financial Management Division for assistance. We were also asked for guidance for programs using the Paycheck Protection Program, or PPP, to cover personnel costs and grant-funded staff. So OVW has not and will not issue guidance for programs using the Paycheck Protection Program because this falls outside our purview. We don't administer the PPP, and we are not in a position to advise you on that matter. Furthermore, I'd urge you to contact your lender and or the Small Business Administration to make sure that whatever you do now doesn't, in the end, jeopardize your loan forgiveness. I'm going to read out a question that was pretty similar to some of the earlier questions that we went over. This grantee wrote that their grant requires quarterly group meetings with community partners as well as a large annual meeting. We have had to delay and cancel these meetings this year so far due to the pandemic. Will we be deemed non-compliant? So please rest assured OVW will not penalize grantees for foregoing in-person gatherings while it's unsafe to convene. And we're well aware that unsafe is relative and subjective. What is and isn't safe changes as this pandemic goes on, and it may vary from community to community and person to person. Many grantees are adapting their collaborative work to online platforms, and others are just pausing their work for the moment. As you've heard me say already, and you'll hear me say again today, communication is key. Talk with your program specialist and let them know what we at OVW can do to support you. As I said earlier too, our monitoring duties have not changed, and it still is our responsibility. Grantees will be penalized if their victim services numbers have taken a dip during the pandemic. Again here, communication. Use your report to explain changes to your case volume. Use the narrative fields to explain anything that isn't captured elsewhere in your form, including fluctuating numbers. Furthermore, the National Network to End Domestic Violence and other national organizations that provide training and TA to OVW grantees have posted some really helpful resources to help victim services providers continue serving their communities during this time. So I would definitely urge you to check out those resources. There were questions about data security and confidentiality when using client databases remotely and whether survey apps are a good way to capture data. So please remember that maintaining victim confidentiality is of paramount importance. So grantees need to track data in a manner that does not jeopardize confidentiality. At times, before and after this pandemic and during, this may mean that you don't report complete data in your progress reports, and that is okay. Use the narrative to explain your missing data or any data collection challenges. As for survey apps, I'm just not sure about that, but I would recommend against using web-based survey platforms to collect data from victims because they might not provide adequate safeguards for personally identifying information. And there were other questions that came in that were focused on technology, safety, confidentiality, and relocation during this time. All of these matters are certainly more challenging than normal right now. I recommend you check out those resources I mentioned from NNEDV and Futures Without Violence and other national organizations with expertise that have put some really helpful and responsive materials out for victim services providers. If you have questions about how to navigate some of these challenges while maintaining compliance with your grant, again, best to reach out to your program specialist. Furthermore, we understand that securing written consent during a pandemic is tough. An effective practice that avoids the need for written consent is for the advocate to secure a three-way call with the victim and the third party and allow the victim to provide the consent or information directly to the third party. If a victim receiving remote services has the appropriate equipment, the services provider may text or email a consent form to the victim who could print it, sign it, and return a photo of it or a scanned copy of the signed consent form. The victim also may sign the consent form using an electronic signature. Notwithstanding these options, recipients may still struggle to secure written consent and should contact OVW to discuss options. We're getting towards the end here, and I'm not sure if I said it earlier, but I want to mention it now. There is going to be a recording of this webinar posted as well as the transcript, I'm guessing sometime next week as soon as it's available. So I know what I'm going over is dense and some of it's complex, and you might need to go back and look for that information. So please know you'll have the recording and the transcript available pretty soon. So just wrapping up here, a couple questions came in about whether MEI will be updating the access databases for tracking data. And those databases are not going to be updated. We surveyed grantees several years ago and learned that very few grantees actually use those databases, and that grantees are increasingly using other solutions. TechSafety.org, that's TECH safety.org, which is a project of NNEDV, has information to help victim services providers select a database that will work for them. And if we can get the link up in the chat, that would be fantastic. Another question was, how do we apply for grants during this time? So we are going to continue to post grant solicitations on our website as they're available, but please note that most, if not all, of our solicitations for this fiscal year have closed, and we won't start soliciting the 2021 proposals until the fall. Another question was about getting MOUs and letters of commitment signed while social distancing continues. So please note that affixing an e-signature to an MOU or an email or letter from the authorizing official of the partner organization is perfectly sufficient. The very last question I'm going to hand off to Tara, and that question is, how will grantees that are working on Macs from remote places be able to submit their report?
Hi, yes, thank you, Ginger. So unfortunately, I can't test the Mac at this time because they're at the office, but from our understanding, the Mac, you use Adobe PDF, Adobe Reader, Adobe Acrobat to fill out the form, and it should function the same on Macs as it does on PCs. If you're finding that that is not the case, we recommend looking at your version and maybe updating your version, as well as it could be that your IT department has set security settings because the Adobe forms are full of JavaScript, which sometimes, depending on your IT settings, the computer looks at it as a virus. So you might want to reach out to your IT department to see if they can make sure that your form is able to work and validate on your computer. I hope that answers that question.
Great, thank you, Tara.
And, okay, great.
So does it make sense for me to start running through the list of questions that you all have been tracking as I've been talking?
Absolutely, and I do have one question I can answer, and I can do that while you look at the chat questions. So there was a general question about, and it says ICJR progress reporting form, section F community measures, which is where you report protection order data. Will those protection order fields accept a blank entry? Will the form validate? This is a really important question, and I'm so glad it was asked. So if you have the instance where you're not able to report on data and you need to leave fields blank, but that interferes with validation, we would recommend you put in a 1 in those fields that need to be validated. And in the last question of your narrative question of your form, so on every single form, the last narrative question is about additional information about the data. In that last question, we would recommend you explain that. So for Tara Wolf, she could explain in the narrative question that she wasn't able to compile this data but needed to put data in for the form to validate. And then your program specialist will see that. And then on our end, when the data comes to us, we can remove that information.
Great, thank you, Tara. So I'm going to just start going through some of these questions. A few of them are items I think I already spoke some to, but I know people might have joined late or just might have not have been clear, so forgive me if I do repeat myself. One question was about the ICJR progress report form and the community measures section, which focuses on protection orders. It was asked if those fields will accept a blank entry and will the form validate. So Tara, I might need your help here because I did say earlier, fine to leave those fields blank, just explain why you don't have the data in the narrative, but do you happen to know, and no worries if you don't, will the form actually validate if those fields are blank?
Yes. So, well, no, the form will not validate, and as I just mentioned, we would recommend just putting 1s in and then explaining that in the last narrative question of the form.
Okay, sorry, that's the same question. I guess I'm sorry. It sounded a little different at first.
It's okay. You were concentrating reading all the chat. No.
Okay. Are we allowed to reprogram travel funds? Generally, yes, especially given these unprecedented challenges. It may make sense and is most likely approvable to reprogram your travel funds, but it's something that you do need to speak with your program specialist about. I know for grantees that I work with, some are saying, hey, we're just going to reprogram those funds. Great. Others are saying, hey, I think we want to extend our project for a while, kind of see what happens and see if some of our planned travel becomes doable at some point kind of well into the future. And I support that as well. So just work with your program specialist to decide what's going to work best for your situation. As I said, we're here to support you, and in many cases that certainly is going to make sense that you're going to take some of those travel funds and put them towards some other, like within the scope of your grant use. That's a great question. There was a clarifying question about funding by October 1st, and another question from somebody who has a current OVW grant and I think applied for some continuation funding or a new grant in this fiscal year 2020. So I think that the short answer that probably covers it here is that our grant cycle is running normally as it always would, which means that we are gearing up to make grant awards or issue non-funded letters by October 1st. Typically, you'll start getting those notifications sometime in September, but October 1 is our cutoff date, so you should expect to hear about whether you're going to receive funding or whether it wasn't selected for funding by October 1st. There were some questions about no-cost extensions, And I want to make sure that by trying to answer questions here, I don't cause any confusion. So, so some of you, particularly grantees who have project end dates in 2020, might have, many of you, in fact, who have those project end dates in this year, were contacted by your program specialist about receiving an administrative no-cost extension. So you wouldn't have had to put in a GAN. We were just going to go into the system and extend those awards. That's partly because that has to do with our data migration and data retention. It's not really even tied to the pandemic. We just want to make sure that we have those projects set up so that when we move some things to a new system, we'll be able to process your closeout and all of that. So if you didn't hear from your program specialist, there's nothing you need to do. If you did, you should expect to see that, that extension coming through soon. You should get a notice in GMS. And if you're a grantee who's in a situation of thinking that you're going to need an extension, which many, many grantees are typically and also especially right now, please know, you definitely want to check with your program specialist, but the general way that we issue those extensions is that you take a look at your budget and where you're at with your project between 30 and 90 days before the end of your current end date. And then think about how long of an extension you might need to go to carry your project on at full capacity. And then you would send a letter to the program specialist or put it in GMS in a change project period GAN. And in that letter, it needs to be signed by the authorizing official. You've got to just briefly justify the extension and say what will be done during the extension period, and also state the balance of funds. And that is the method for getting an extension. But if you have questions about whether now's the time to do that or anything else that might be needed for your extension, do contact your program specialist. There was a question about, is it okay to provide services to individuals outside your service area? So my cautious answer to that is yes. I mean, if you have services available and the capacity to serve somebody who's coming to you for help but is outside whatever your service area is, I think the answer to that question should be yes. I would say just, again, check in with your program specialist, make sure there's not something that I'm not thinking of here yet, but that really ought to be fine. Did I cover everything from the chat questions?
I think so, but you know, they're, from what I can tell, you have, yes.
Great. I see one other thing I'm just going to quickly address, and that was it's kind of tied to this if you applied for new funding question. So nothing's changed for us. If you get a grant award for an application you submitted this year, chances are that start date is October 1st. That doesn't change for us. So you should expect it would be just like any other year applying for grants, at least from an administrative perspective. So that's all I have. I really hope that you all found this helpful, and please know that we at OVW have so much respect for all the work that our grantee community is doing to address violence against women and to serve victims and to hold offenders accountable. And we, again, want to do anything that we can to support you through these difficult times. So thank you for your time today. Our contact information is on maybe the next slide. But you can feel free to reach out to me or Tara or Emma, who, if she hasn't already, can put her email address in the chat box as well. We are happy to answer your questions and point you in the right direction. So with that, thank you so very much, and let us know how we can help. Take care.